I'm ready. Good evening, guys. My name is Jamell James, and today I'll talk to you about the importance of CPR. I want everybody to think of their loved ones. I want you to think of that special someone to you in the whole world. Now picture that special someone in an emergency situation in desperate need of CPR. CPR is a life-saving mechanism, and if initiated correctly and properly, can save the life of your loved one. Knowing these essential tools can put you in a position to save the life of someone. It's simple steps that could lead to a rewarding, life-saving outcome. The first step is to be able to identify an emergency situation. This is usually a person laying on the ground unconscious and not breathing. Once that is established, the next step is to assess the area for harmful or dangerous material. If there is another person in the area, you would have to ask that person to call 911. If no one is in the area, you have to assess the scene and be prepared to initiate CPR. Next, check the victim for signs of life. Signs of life is if the person is breathing or gasping for air. You can also yell out to the person by saying something simple as, "Hello, are you okay?" We wouldn't want to perform CPR on a person who's just catching some Z's. After yelling that, wait for a response. You then want to check the person for a pulse. This may sound foreign to you, but I'm sure you've seen it in movies over and over again, and reenactment of placing 2 fingers under the neck. Well, it's the exact same concept. You place 2 fingers under the neck like this. You should feel a pulsating vibration. If this is absent, there is no carotid pulse. Now, CPR consists of 2 rescue breaths and 30 chest compressions. You continue this cycle until emergency support arrives. Or you can no longer perform CPR. And if you're not alone, you and that next person could rotate the cycle. You begin CPR with 2 rescue breaths first. In order to deliver rescue breaths, you have to tilt the head back and pull his chin down, creating access to an airway through the mouth, which goes something like this. Tilt the head back, pull the chin down. You then pinch the nose closed and place your mouth over the victim's mouth. Deliver 2 rescue breaths, delivering air at 1-second intervals. To ensure adequate air delivery, you watch for the rising of his chest. If no chest rises, you will need to reposition or retry. After 2 breaths, proceed with 30 deep chest compressions. Using the heel of your hand, measure from armpit to center of chest, like this. From here to here. Once in the center of chest, place the heel of your hand on the lower part of his sternum or breastbone, with your fingers in a lock, like this. Leaning forward and arms extended. With arms straight and leaning forward, begin compressions, pressing about 2 inches or 5 centimeters in depth. Try to maintain hand placement, and remember, 30 chest compressions. Try counting while doing compressions. Once you're complete with the 30 chest compressions, proceed again to 2 rescue breaths, as shown earlier. Do this rotation for 5 cycles. If there was no one able to call 911 and 5 cycles is complete, you will then stop and call 911. After calling 911, you continue with this rotation until emergency support arrives, or you no longer need to perform CPR. Here's how one full cycle should look. Hey, are you okay? Check the pulse, no pulse, tilt the head back, pulling the chin down, creating an airway. From here, you measure to the center of his chest, interlock your hands fully extended with the heel of your palm, 30 chest compressions. That's one full cycle. Now you are officially a person noted as a potential lifesaver. Thanks for your new knowledge of how to perform CPR correctly. To receive a CPR certificate, you can go to the American organizations as the American Red Cross or your local hospital to see if they offer CPR training to non-healthcare providers. This is the end of my class, and thank you for listening.